Okay, given it is Men's Mental Health Week in Australia, let's talk about this critically important issue. Not just men, women, everyone. What are we seeing, how are we feeling, and what impacts has the pandemic had at the moment? Dr. Deepak Gore is a pop-up GP and he joins us in studio. Always great to have an in-studio guest. How are you today?
Good, how are you?
Going very well. I mean, this is just, it's such an important issue. I know that's such a cliche, but particularly now, maybe just wrap up what you've been seeing with the last 12 months.
Yeah.
How are people feeling at the moment, do you think?
Look, I think the fundamental issue is that people have found it very difficult to cope with the uncertainty. And uncertainty affects multiple aspects of people's lives. Obviously, we know that there are people whose jobs have been changed, whose hours have been changed. We know the effect on small business when they've had to close down for periods of time. But it's also affected relationships, affected education of young children, affected obviously people's ability to travel. And so there's multiple aspects of people's lives. And obviously it's been a long period of time. And I think the fundamental thing we're seeing is that people are reacting differently to these changes.
Yeah, right. There are so many questions that I could ask. In terms of the conversation that you see right now, because we seem to talk a lot more about it,
Yes.
but then you see the numbers that come out and they still, there's worrying trends in a way. So what's the gap that we need to bridge between conversation and then changing, I suppose?
I think it's far more socially acceptable to talk about mental health now than it was, say, a decade or two ago.
Yeah.
But still, we see that some people are reluctant to have those conversations. I think the conversations often start at the home with a friend, a family member. It might be a parent, it might be an adult child. But I think it's important to encourage people to go forward and see their general practitioner and talk about these issues. We have a number of options available to us to treat patients. We have different ways of seeing patients with, for example, telehealth now. And also some of the people we work with, such as psychologists, they're seeing patients via telehealth as well. So I think it's important to encourage patients to come forward and when they think they need help.
Yeah, let's get on that in just a moment. One final one, just in terms of the general environment. How important do you think it is for people to lead the way and say, look, I'm struggling, I'm seeing this person, the psychologist, whatever, to be, because people probably don't often think that, but that can be quite powerful, can't it?
Yeah, I think it's important. If you can get support from your peer group, it might be from your manager at work, that's very, very important. And I think having those conversations about allowances you may need, whether it's your personal life or your professional life, is very, very important.
Yeah, absolutely. So let's talk more about what you're up to and what's on offer at the moment.
So there are plans called GP mental health treatment plans. They've been around for several years, and what it enables a patient to do is see a general practitioner, have a long discussion about their mental health. Usually I take about 40 to 60 minutes on that. And it's a very long discussion in detail about what's happening now, perhaps what's happened in the past, and think about what options in terms of treatment would be helpful for a patient. We may send someone to a psychologist, we may send someone to an occupational therapist, a social worker, perhaps a psychiatrist. And there's a plan that enables patients to access some of these services which typically were not available on Medicare, to at least get a Medicare rebate from about 10 consultations a year. They can have an initial plan, and then usually 1 to 3 months later they can have a review and they can get more visits. So initially it's 6 visits, then it's 4 visits, and right now I think the government understands that people are under a lot of duress, so they've introduced a sort of a bonus number of 10 visits up till the end of June 2022. So these are all plans and strategies to enable patients to essentially treat their mental health, so hopefully we can improve their symptoms.
And so is that outside Medicare as well? That can be anyone?
Yeah, so you can see, we can send you to a psychologist tomorrow, through a non-Medicare process, but Medicare actually has this process whereby Medicare will subsidise a proportion of visits. So we'll subsidise generally 6 visits for a plan, 4 visits for a review, and then another 10 visits as a bonus until 2022.
Awesome. Just finally, how optimistic are you feeling? I guess, when we talk about Australia, that we're heading in the right direction in this space.
Look, obviously we've got a very low number of cases. We've had a very low number of deaths. Every death is tragic. Our vaccination rate is improving, but it needs to continue to improve. Our vaccination rate is still very, very low overall. Coincidentally, I'm having my second vaccine tomorrow, but I know there are very few people I've met so far who are fully vaccinated, including healthcare professionals.
Interesting. Thank you so much for coming in today. Where can we check out all of your work?
You can find my work at popupgp.com.
Awesome. Thanks again. We'll talk soon.
Thanks, Adrian.